Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, Kiko Auctions, and, of course, our technical producer, J.D. DeAngelis. In the studio with me is Nancy Warmby, Executive Vice President of Medicine Center Pharmacies, and our very special guest, Nicole Solinsky, diabetes educator and licensed dietitian at Mercy Medical Center. Good morning, Nicole, and welcome to the show.
Thank you so much for having me back again. I'm really excited to be here.
So diabetes is a challenging disease to manage successfully. From medication to monitoring and from exercise to diet, there is a lot to coordinate, to understand, and to manage. Although the care regimen is complex, patients with good diabetes self-care behaviors can attain excellent control. Patients do best when they understand what they need to do, when they feel empowered to effect a change in their life, and when they believe the benefits exceed the costs. Today, Nicole will share her knowledge and tips to help you, your loved ones, or anyone you know with diabetes understand how to manage it. We'd like to remind our listeners that today's program is available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
So, Nicole, you've been here before, but you need to tell everybody who you are and what you do.
All right. Again, my name is Nicole Solinsky. I am a registered licensed dietitian. I work for Mercy Medical Center currently as their diabetes education coordinator. I've been with Mercy about 20 years. In this job capacity, about 2.5. So,
for those unfamiliar, what exactly is it?
Well, diabetes, basically, in a nutshell, is a disease that your body does not use glucose, which is a form of sugar, properly. Glucose or sugar is our main source of energy for all of our body's functions. So when our body's not using that main source of energy properly, it really can cause a lot of problems for all of our systems that are trying to work together.
So we have an oversupply of it, and that's sort of what diabetes is?
So when you eat certain foods, which I'm sure we'll talk about later, break down and turn to sugar, your body or your pancreas produces something called insulin. And insulin is responsible for hooking to that sugar molecule and kind of like a key, unlocking it and pushing it out to be used for energy in our body. And when we do not have diabetes, we have the exact amount of insulin or exact amount of keys to hook to each of those sugar molecules to get it out of our bloodstream to be used. And when we're diabetic, we're either not making enough insulin anymore or enough keys, or those keys aren't fitting the lock properly and that sugar is staying in the bloodstream and not getting out and being used for energy the way it needs to.
I see.
So, Nicole, we know that diabetes is very prevalent, but can you tell us how prevalent it is?
Yes. Unfortunately, there's over about 30 million children and adults that have diabetes in America. About 86 Americans have what we call prediabetes, and this used to be called borderline diabetes. But the concerning factor in this is only about 11.1% of those 86 million Americans actually know that they have this. So there's a lot of people walking around out there that are in that borderline phase that, don't know. And a number coming from the American Diabetes Association comes down to about 4,110 people in the U.S. get diagnosed with diabetes each day.
Oh, my gosh.
Yeah.
That's staggering.
Yes.
I thought I read somewhere almost a quarter of the population between diabetes and prediabetes.
Well, if you put those two numbers together, I bet that, I don't know the total population number, but I bet it's probably pretty close, yes.
That's just overwhelming.
Yeah.
So what about the difference between type 1 diabetes and type 2 diabetes?
Well, type 1 diabetes is, there is a genetic link to it. When I talked about that insulin and that pancreas, when you're a type 1 diabetic, your pancreas completely stops making insulin. So there's no more keys, there's no more insulin, and you have to have insulin to live. So that is why somebody who's a type 1 diabetic will be on insulin, forever to replace what your body is not able to make anymore. For somebody who is a type 2 diabetic, your body's still producing some insulin, but if you've ever heard the term insulin resistance, it's not working right. That insulin isn't, like I said, connecting to that sugar and getting it out to be used for energy the way it should.
What about adults versus children? Is there a difference in their symptoms and in how you manage diabetes?
Actually, children and adults really can have the same signs and symptoms of diabetes. The issue, though, is, depending on the age of the child, or, they can't really tell you that they're feeling off, or you might not notice certain things. Some of the key signs and symptoms for diabetes are going to the bathroom, very frequent urination. So if you notice your child is, having to go to the bathroom all the time and it's kind of unexplained, a very much increased thirsty all the time, wanting to drink, really hungry often, more than, what would be normal, feeling very tired, not having any energy. And those four things really come from the fact that your body is not using the energy that it should be, because it's staying in the blood and not getting used. Blurry vision is another really big factor in that. When our sugar's high in our bloodstream, our lenses behind our eyes swell and can cause our vision to become blurry. And this can ebb and flow based on if your sugars are higher or lower. And then unexplained weight loss sometimes can also be a factor in that. So those are one of the 6 big signs and symptoms to look for diabetes.
Okay, so what is gestational diabetes, and how does that differ from type 1 and type 2?
Well, gestational diabetes is a type of diabetes that women get when they're pregnant, and it has to do with, hormone levels, and things like that. Typically, it's seen or diagnosed or found around 24 to 28 weeks via certain blood tests. Sometimes your doctor will test earlier if you have diabetes in your family or genetic more predisposition. Typically also when you have the baby, that type of diabetes goes away. But most people don't realize as women that you are about 50% more likely to get diabetes later on in life if you've had gestational diabetes. So that's something that I really try to stress with our gestational patients is, you have the baby, your sugars go back to normal, but you need to make sure that you're continuing to get your sugars checked, because it can creep up on you.
The percentage of women that after delivery go back to not needing support, drugs, testing,
I don't know exactly that percent, but I do know that, more often than not, your sugars will go back to normal. And they say it's a 50% increase within 10 to 20 years after delivery. So that's kind of where, you're looking at possibly your numbers.
So essentially what we're saying is they're predisposed to diabetes, whether they're pregnant or not. Is that correct?
Not necessarily, because when you're pregnant and you get gestational diabetes, I have patients who have no history of diabetes in their family and they get it during pregnancy. Sometimes it's just that luck of the draw with, how your hormones are or how your pregnancy goes, or, sometimes if you had to have potential hormone therapy to get pregnant, a lot of those things play a factor in that.
Can we talk about pre-diabetes?
Sure. What would exactly the difference with pre-diabetes and diabetes is pre-diabetes, or what we used to call borderline. It's more of a condition that's characterized by slightly elevated blood glucose levels, where a person isn't at that diabetes diagnosis level of their blood tests, but they're not in normal range either. I describe this with my patients as like that big yellow flashing caution light. You're in a position right now where you can either not do anything and become diabetic, and it could be very quickly, or it could take a few years, but you will become diabetic. That's kind of what will happen. Or you can make some changes and kind of head that diabetes off and possibly prevent it from happening.
What would the blood glucose readings be for prediabetes?
So a typical hemoglobin A1C level for a pre-diabetic is anywhere between 5.7% and 6.4%, where 6.5% or above is a diagnosis of diabetes, so 5.6% or below puts you in that normal range.
And an individual with no diabetes, no pre-diabetes, what should their A1C be?
Less than 5.6 is considered, 5.6 or below is considered in the normal range.
I guess we should explain what the A1C is.
Yes. So hemoglobin A1C, that is a test that, blood test that your doctor will do that tests your average blood sugar over a 3-month period of time. So, when you get that done, it comes out in a percentage, and that's kind of how the standards of care are used to determine where you're at and where you fall and what your concerns might be.
Is it really an accurate test?
It's
we got nothing else.
But yeah, it's been used for many, many years. So they're definitely still using it for diagnose purposes, tracking purposes, all of those things. So it's got a pretty good track record, yes.
Okay.
Mm-hmm.
Okay, so let's say you've been diagnosed with prediabetes and you are vigilant and you want to stop it from becoming diabetes. What should you do?
The two best things that you can do to help prevent progressing to diabetes is, at that point, as a pre-diabetic, is through diet and exercise, moving more. Those are the two big keys. Sometimes you'll be put on a medication, sometimes not. But if you do, then it's kind of that threefold: diet, exercise, and medication or not.
Well, it's about time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Welcome back to Health Matters with the Medicine Center Pharmacy. Nancy and I are talking with Nicole Solinsky, diabetes educator and licensed dietitian from Mercy Medical Center. Have a question? Post it on our live Facebook feed.
All right, Nicole. So maybe you've been diagnosed as prediabetes, or maybe you just have a concern. How often should you be tested, and what tests should you maybe be requesting?
Well, we just talked about a little bit about that A1C a little bit ago, and that's one of the tests that definitely I would encourage you to ask your physician to get tested for. You also can just get your normal, sugar level, your glucose level done. When you get that done, that's kind of that one snapshot of that one piece of time, what your sugar is. And then you have the A1C that tests your average over 3 months. So those two together are a pretty good indicator of where things are for you.
And listeners, if you are concerned, I should mention also that at the Medicine Center Pharmacy, we can do a blood glucose test for you without a physician order or an A1C test. So stop in and talk to one of our pharmacists if you have that concern and would like to find out your numbers. What about genetics, Nicole?
And genetics plays a role in so many things, and diabetes is no exception to that. If you have, for example, one parent with diabetes on their side, that puts you a little bit more predisposed to diabetes. And then if you have two parents, that kind of raises that percentage a little bit. So if you have any genetic predisposition, I encourage everybody, at minimum, to be getting your blood tested a couple times a year to make sure that your numbers are staying where they need to be.
So you have the title of diabetes educator.
I do.
Can you explain to our listeners what that means and what you do?
Sure. As a diabetes educator for Mercy, what that entails, I run our outpatient diabetes education program. We do all kinds of individual counseling for our patients. We do group setting classes, which we have, in my opinion, one of the most comprehensive diabetes education programs around. There's really so much involved to diabetes that patients don't realize. It's not just a 10-minute conversation and then you know everything you need to know. I describe it as, diabetes is like this 1,000-piece puzzle, and every time you would meet, whether you're coming to classes or, your individual education, you're going to put more of those puzzle pieces together. So by the time you would be done with our comprehensive program, which only includes 5 appointments, you would have that full picture of what you need to know for diabetes. Knowledge is power. The more you know, the more you can control and have those conversations with your physician to work towards, getting this under management.
Yeah.
So, what is a normal fasting blood sugar?
So, normal fasting blood sugar is considered between 80 to 130 by the American Diabetes Association standards. There's a couple times you could be checking your blood sugar. Fasting would be that sugar you check typically first thing in the morning before you eat or drink. So if you were checking that number, ideally you would want to see that range between 80 to 130. If you were checking what we call a post-meal number, which is 2 hours after the start time that you eat, by the ADA standards, that number you would want to see would be less than 180. So there are some different standards and numbers that you're looking for based on when you would be testing your blood sugar.
I thought that was less than 160. No.
It's less than 180 according to the ADA standards.
Okay. All right. Works for me. So, okay. What foods influence blood sugars the most? And while we're at it, we know there's a heck of a lot of sugar in beverages. Sugar beverages, of course. So where are we at with that?
Well, there's three main food groups that have a little bit more impact on your blood sugar. And when I talk about these, I want to be very clear that I'm not saying that we shouldn't eat them, okay? Because they have very important nutrition value, but they are going to have a little bit more impact on your blood sugar. So the three food groups are our starches and grain group, which is our pasta, rice, crackers, cereals, things like that. Our fruit, which includes all of our fruit and fruit juices, dried fruit, and then our dairy products. And that typically only includes, when we talk about that in blood sugar control, is our milk and yogurt. So when you eat those foods, they have a little bit more impact on your blood sugar. So we always talk about in diabetes management, balancing out our foods. So you want to make sure when you have those three food groups that you're balancing out and having, sources of protein or healthy fats or our non-starchy vegetables, which we consider a little bit more of the stabilizers. So when you have them together, your blood sugar is it's going to be more stabilized and not rise quite as much.
What about cheeses and breads? Things like a hamburger bun or something.
Well, bread is considered, a start in the starch group, and then is a carbohydrate. So when you eat that, it definitely it will break down and turn to sugar. When we talk about whole grains, the more fiber you have, the slower the digestion. So the less it's going to raise your blood sugar. So there is a difference, for example, in potentially 100% whole wheat bun versus just a white bun. They're both still carbohydrates in the starch group, but one is going to digest a little slower, which is going to raise your sugar less.
So, never knew the answer to this one. Do cheeses vary in what type of cheese it is, like New York Sharp or whatever?
So, cheese is actually considered a protein when we talk about the diabetic diet, which is kind of that stabilizer. For the most part, an ounce of cheese, whether it's mozzarella, cheddar, or whatever, has pretty much the same amount of protein. So, it's pretty much they're all pretty much going to be the same as far as when we talk about adding that, say, cheese to your crackers, to kind of help balance out that snack.
Okay. All right. What about pizza? Cauliflower crust has come along?
Yes.
As compared to bread crust.
Right. So when you add, there's whole cauliflower crust, there's half cauliflower crust. When you add that, you definitely are decreasing the carbohydrate amount in there. You're going to have a little less of calories, a little less rise in your blood sugar. So it's definitely a great way to have a pizza, because a lot of times, we don't just have one piece of pizza like we're, talk about having that, So it kind of helps to give people, that pizza that they really crave or want, but not impact their blood sugar maybe as much as, the typical type of dough or crust that we would have.
While we're on foods, what about the vegetables and what about fruits? I know fruits are full of sugar. Okay.
Well, fruits are a natural sugar, okay? Fruits are also very nutrient dense and very important to have in our diet. When we talk about vegetables, there's two types of vegetables. There's starchy vegetables, which considered are corn, peas, potatoes, and then our non-starchy veggies. So when we talk about corn, peas, and potatoes, those are more considered on the carbohydrate side. So when you eat those, they're going to have a little more impact and rise in your blood sugar. All of the other vegetables, our cauliflower, broccoli, carrots, mushrooms, onions, lettuce, all of those things, those are non-starchy veggies. And those are what I like to call, or my counterpart likes to call belly fillers. They're the ones that help us to feel fuller longer and stabilize our blood sugar.
I thought carrots were full of sugar. No?
No. Mm-mm. Nope.
Okay.
Now, when you add the honey and the candiedness to them, then they add a lot more sugar. But, half a cup of, cooked carrots is the same amount of carbohydrates as a half a cup of cooked broccoli for the most part.
Okay, so we can't eat potatoes anymore. What else can't we eat?
You can eat potatoes.
Corn?
Absolutely, you can eat potatoes. When you have potatoes, you want to make sure that you have, your chicken or your pork with it or something like that. The problem is the serving size is often instead of having maybe a quarter of our plate of potatoes, we have half of a plate are potatoes. So, where you can shift that a little bit is, add a little bit more of the belly fillers, still have some of your potatoes, and then make sure you have your protein source with it as well.
Bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Nancy and I are discussing tips to manage diabetes. Nicole Solinsky. We've got a lot more to cover this morning, so let's get back to the show. So true or false, Nicole? Diabetics simply cannot have any sugar.
That is false. As we know, and we just talked about, there's a lot of different things that turn to sugar when we eat them. Sugar is not the only thing they used to think, that cupcake and then I'm good. So it's really about balancing. There's not one food that you should never have. There's foods that can obviously impact your blood sugar more than others. So if you have them, all of the time and you're drinking things that are full of sugar all the time, you're definitely going to put more stress on your pancreas to burn out quicker. But there's not, no, you can never have sugar. That is not realistic, and that's not going to be a long-term benefit or effect that's going to last either for the patients.
In our discussion about what's good and what's bad for you sugar-wise, what about juices, orange juice, grapefruit juice, all those? I mean, you're loaded with sugar, but...
the more processed you get, for example, an apple to applesauce to apple juice, the more impact it's going to have on your blood sugar. So juice is definitely, when we think about how we treat a low sugar, we drink juice to bring it up very quickly.
Sure.
So juice is not something that we recommend that you have all of the time. If you do have juice, we definitely recommend that you have, like around the 4-ounce serving, and you have it with other food, with a meal. So it's going to have a little less direct impact on your blood sugar. But juices, pop, regular soda, full sugar Gatorade, all of those things, sometimes you can just cut back or cut out those things and make a tremendous impact on improving your diabetes if you're intaking a lot of those things often.
Okay, so it's generally known I'm a type 2 diabetic. Okay, I used to love orange juice. Okay, but I've lost the taste for it. Is there, with individuals with diabetes, I mean, and like cider and all those really sugary drinks, I've lost the taste for all those. Is that...
Well, when we talked about the signs and symptoms, when people are diabetic or they're not their sugars are high, they're very thirsty. And a lot of times what they crave is things that are full of sugar to drink. So sometimes then we get hypersensitive to, wanting that sugar taste. So as you kind of wean yourself off of it, then oftentimes you don't crave those things like you did before. You just kind of lose that hypersensitive need for that sugar taste. And then it becomes almost like you just don't really want it as much anymore.
I don't see this on our planogram here today, but what about sugar-free drinks. There's all kinds of sugar substitutes out there now.
There is, and people can argue back and forth all of this discussion. When you're looking at it from a diabetes management perspective, sugar-free is not going to have an impact on your blood sugar. So if I have a patient who's coming in and drinking, a 2 liter of Mountain Dew a day, and his first step is to work on going to Diet Mountain Dew, then I'm for that. Then we go, okay, now you're kind of, we need to kind of wean off of that a little, because too much of sugar-free stuff is not good either. But when you're looking at it from a diabetes management of sugar, trying to control your blood sugar, definitely it is a step in the right direction, in my opinion.
What's your take on the difference between, what are there, 6, 7, or 8 different sweeteners,
Again, we could have lots of discussion with that, but typically, when we're looking at what is your best choice or the healthiest choice, the most natural choice is going to be the substitutes that are made from stevia, which is going to be your green packet. Whether it's the name brand or the generic version, they all come in a green packet, and that's kind of going to be the one that's the most natural and preference of choice.
Hey, I'm not endorsing anything, but I think Truvia has the least aftertaste. Some of the things going way back to saccharin, have a pretty miserable aftertaste. You brought the color up. All of those sweeteners have or color code packets. Pink and
pink, blue,
green.
Yellow, and green pretty much are the 4.
Okay. I mean, I still see saccharin on some of the tables in restaurants, which really surprises me because of the advancement in sugar substitutes.
Sometimes that's a cost issue, too. And sometimes, if you've the Splenda and the stevia haven't been out as long. So if you're an older, population and you've been using
saccharin or whatever,
some of the other ones, you just aren't changing, and that's what you're going to stick with. So,
personally, I made my first apple pie with stevia a couple weeks ago, and JD's smiling. But I was concerned about it because, when you add the sugar to the apples or to any fruit, that makes the sauce and the syrup to make your pie sweet. And so my concern was, what's going to happen when I use stevia? But it really, really came out well. And I've had good luck with stevia making salad dressings. And maybe if you want to take a minute, I know salad dressings can have a lot of hidden sugar in them, as well as other condiments.
Yeah, they can. That's where, educating on label reading and what to look for, is definitely something that we do with all of our patients, because it can get very confusing. What do I look at? Do I look at everything on this label? Am I just concerned with what am I looking at? So sugars definitely, are a part of that. But honestly, when we're looking at the grand scheme of things, yes, we can make changes in our salad dressings for sure, but usually diabetics, that's kind of probably not the area they're getting the most sugar from, and then we kind of stepping stones, meet that patient where you're at. Like I said, if they're starting with 2 liters of Mountain Dew, we got to work down from there. But stevia is definitely a good choice, and you can use it for many, many different things. And a lot of times it's a trial and error in what you want to bake with it or, use it in different things.
Apparently stevia must be more expensive than the others because it has begun to show up in beverages, some of them, but not, not like the sucral products and things like that over the years.
Yeah, and it does have a different taste, so somebody who's used to using, like you're saying, saccharin versus it's going to taste different. It's going to make your coffee different. It's going to make your iced tea taste differently. So it's a matter of change and adjustment, and sometimes people don't. That's hard.
I kind of needed with the stevia to sort of adjust how much of it I use because once you put in too much, it's sickening sweet. Yeah. And if you don't put it in enough, it's not sweet at all. So
that's where that trial and error comes from for sure.
And I actually came up with with a liquid stevia in a little bottle about so big. And 1 drop, 2 drops, whatever. And that actually I felt is the much better way to measure that as opposed to opening a packet and dumping it out or a shaker or whatever. So
and with drops or packets, as you're weaning, you might start with 2 packets and then go to 1.5, or so you're kind of, you can adjust it, that way via drops or the amount.
But the consumer is just so over-sugared and has been for years. I mean, it's amazing to watch some of these people when they get a cup of coffee and 3-4 teaspoons of sugar. And
I mean, honestly, sugar is the more you have, the more your body wants, the more your brain tells you that you need. It's almost like a drug, the way it chemically alters your brain. So that's why it's hard for people to cut back because they're used to that taste.
Exactly. And it took me a long time to get from Coke, I guess I shouldn't mention sugar beverage to diet beverage into water.
Yep.
So I don't drink a lot of beverage anymore, mostly water and tea.
Yeah.
And, that sort of thing. But I think there's a lot of people who are unwilling to make that move.
You have to first understand why you need to do that and what diabetes is doing to your body. And a lot of times that's where some of that education comes in, and then they kind of, oh, okay, I get it. And when we go and show them, okay, you can just make this one change and that's going to make a difference. And then we'll go to this next change rather than everything at one time, because that usually doesn't ever stick.
Yeah. So we haven't got to it yet, but we're entering the very festive time of the year. How about alcoholic beverages?
Okay. Alcohol is a whole other subject. Alcohol is digested a little bit differently in our body than foods are, and it impacts your blood sugar a little bit differently. It can have a hypoglycemic effect, which is a lower blood sugar effect later on after you drink it. The biggest thing I could say is obviously in moderation, and if you're going to have a drink, try and have it with food, because it's going to help to stabilize the impact on your blood sugar. And try and stay away from a lot of the drinks that have so much sugar in them. There's actually some great drinks out that, are made with the flavored waters and, that are going to have less sugar, but still allow you to have, a drink or two at the holidays.
Well, if we're talking about alcohol, what about across the scene with various types of wines? Like, okay, the French wine, I forget what it's called. It's supposed to be lengthening your life.
I'm no wine connoisseur, honestly. I'm going to be honest, but for the most part, 4 ounces of wine counts as the same as one carbohydrate serving, which is 15 grams.
Wow! Yeah. So it can add up quickly.
Very.
Yeah.
And beers, I'm sure, have even more. So.
It's about one beer is about the same. It's about one carb serving.
Even a low. What do you call it?
Now, again, I'm not that connoisseur, but, there's different now things that are, have less carbs and things like that. So you can take that into effect.
And what about all the beers that are in these beer stores, places that make their own beer on site? They're higher in alcohol, I'm told.
That's what I'm told as well. Without having nutrition values and information in front of me, I really can't give you direct, solid answers on that.
Very interesting. Okay, we're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com.
Welcome back to Health Matters with the Medicine Center Pharmacy. Nancy and I are talking with Nicole Solinsky, diabetes educator, licensed dietitian from Mercy Medical Center.
So, Nicole, you've shared a lot of information about dietary changes and things that we have to be aware of. But what about complications? What if we're not taking care of our diabetes? What can happen?
Well, I'm very glad that you asked that question. Diabetes is one of the only diseases that can affect every single part of your body, from your skin to your eyes to your feet to your heart to your gut to your everything. The biggest thing with diabetes complications that people kind of hear about, your vision can be affected. That's called diabetic retinopathy. Retinopathy is actually the number one cause of blindness among Americans, is due to diabetes. You can have neuropathy issues, which is poor circulation problems. You can have different types of skin issues, lack of healing. As a diabetic, you are 2 to 3 times more likely to have a cardiovascular event or a stroke. And even people don't even realize diabetes can affect your mouth and your teeth. So, there's so many things that you need to be aware of. And, it's not always fun information, but the more knowledge you have, the more that you can kind of pay attention to those things and head them off before you potentially could have problems. One of the biggest things that I tell patients is that diabetes doesn't necessarily hurt. You don't always feel bad. You don't always feel like there's something wrong until sometimes it's too late. And that's why staying on top of it and knowing and getting knowledge can be very, very helpful.
So we're down to snacks. Everybody's eating most of the time. They're driving down the road, drinking a cup of coffee, or eating a donut, so what's a snack?
So in a perfect world, an awesome diabetes snack would include a carbohydrate source and a protein or a healthy fat source. Again, we're coupling that stabilizer with possibly, one of those other food groups that are going to have a little more impact. So for example, like an apple would be the carb source and a string cheese would be the protein, or a yogurt with a handful of nuts, peanut butter, cracker with some crackers, whole grain crackers. You can even make a trail mix with, some almonds and some maybe a little bit of dried fruit. So you're getting that combination of both pieces to the puzzle.
Can I throw a question in there too? What about the timeliness of when people eat? So, there's a lot of talk now about skipping breakfast, don't skip breakfast, or fasting.
Intermittent fasting, yes. In my opinion, that is not the best practice for a diabetic. The goal for a diabetic is to stabilize your blood sugar and be as consistent with that as possible. And one of the best ways you're going to do that is to make sure that you're eating at regular intervals. A good rule of thumb is not to go more than 4 or 5 hours without eating. So that means breakfast, that means lunch, that means a potential afternoon snack, dinner, and then maybe even an evening snack. The more that you can have those regular intervals, the more stabilized and even and in control your blood sugar is going to be. Okay. And if I can just say something too in that respect with taking medication, that's also one of the biggest things that we see with diabetics is the inconsistency of taking medication. And it's really important to know how your medication is meant to be taken and to take it when you should, especially with diabetes. And that is, where the pharmacist is the expert in that.
Mm-hmm.
In the nut category, almonds best, or are they all okay?
They all have different nutrient values, and they're going to give you different things when you eat them. Almonds, walnuts, pistachios, they're all good. So if you, I guess regular peanuts are kind of the low man on the totem pole. Yeah, sure. But if you like mixed nuts, the recommendation is a quarter cup of a mixed nuts or seeds every day. I get one of those little Tupperware like salad dressing things, and I fill it up with different nuts every day, and I just kind of have that as a snack. And that's, it's easy. You think, a quarter cup, but when you actually are eating a whole container of something, even though it is only a quarter cup, it makes you feel like you're eating a little bit more. So there's a little mind trick for you.
Okay. Almonds I've always heard were the best.
They're definitely a good choice. Mm-hmm.
Okay. I'm not sure if we hit this already, but what do servings of vegetables, fruit, proteins, and healthy carbs look like? And how many servings should an adult and children have each day?
Well, when we look at, the perfect scenario, most people have seen the My Plate sort of approach where, you have a quarter of your plate being your carbohydrate or your starch grain serving. You have a quarter of your plate being your protein serving with your meats or your your eggs, things like that. And then half of your plate being your non-starchy vegetables, and then throwing a piece of fruit, on the side. That would be kind of that perfect scenario. Ideally 5 to 9 servings of fruit and veggies a day, 6 to 9 grains, depending on your age, size, gender, if you're trying to lose weight, maintain, things like that. But, the My Plate is kind of the easiest visual to go look at when you're looking at how you should ration the different food groups.
Yeah.
Okay.
Before we go any further, I don't want to lose the chance. Can you share your contact information if people want to get a hold of you and have questions?
Absolutely. My direct phone number is 330-489-1484. That's right to my office. My email address is Nicole, Nicole .Selinsky, SELINSKY @cantonmercy.org. That's all one word. I'm love to answer any questions you might have about our program. If you're interested in learning more, we do need a doctor referral for any patients to come see us. That's typically not a problem. And then I will say that almost all insurance companies, cover this type of education. So that is definitely a benefit as well.
Yeah, and I'll say too, I have a family member that attended your classes and just has been very complimentary, very, very positive about all that they learned, and best of all, their A1C dropped dramatically after going through your education classes, and we sure as a family are very appreciative of your services and what you do.
Well, I really appreciate that, and those are the stories that, I really love to hear, and, it means a lot because that's kind of why I'm here doing what I'm doing to help people manage their diabetes.
Are you in 5 days a week?
I am not in 5 days a week. I typically work 3 days a week, but we have, people who can answer phones, or I get my emails every day.
Thanks very much, Nicole. Nicole Selinsky, diabetes educator and licensed dietitian at Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your health care provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.
Get the podcast at WHBC.com.